How does knowing HPV types help reduce cancer risk? Imagine you're trying to protect yourself from a hidden threat. Knowing which types of human papillomavirus are involved in an infection is a key step in reducing the risk of developing certain cancers. Different HPV types have different potentials to cause cancer, especially in areas like the cervix, anus, penis, vagina, vulva, and some parts of the head and neck. By identifying the specific types present, healthcare providers can create targeted prevention and screening plans that are more effective at stopping cancer before it starts. HPV types are divided into two main groups: low risk and high risk. Low risk types, such as HPV 6 and 11, mainly cause genital warts and are not usually linked to cancer. High risk types, especially HPV 16 and 18, are responsible for the majority of HPV-related cancers. Other high-risk types include HPV 31, 33, 45, 52, and 50. Knowing which types a person has helps doctors assess their individual risk more accurately and decide on the best follow-up actions. Vaccination is one of the most powerful tools in reducing cancer risk. Vaccines like Gardasil 9 protect against the most common high-risk HPV types, including 16, 18, 31, 33, 45, 52, and 58, as well as type 6 and 11 that cause genital warts. When given before exposure to the virus, especially to children aged 9 to 14, these vaccines can prevent persistent infections with these high-risk types. This significantly lowers the chance of developing cancers linked to HPV, especially cervical cancer. Vaccination is most effective when administered before someone becomes sexually active because it prevents initial infection with these dangerous types. Screening is another vital part of reducing cancer risk. Knowing which high-risk HPV types a person carries allows for more precise screening methods, such as HPV DNA testing combined with Pap smears. For example, if a woman tests positive for HPV 16 or 18, her healthcare provider might recommend closer monitoring because these types are more strongly associated with progression to cervical precancer and cancer. Detecting high-risk infections early means treatment can be started before cancer develops, greatly improving health outcomes. Identifying HPV types also helps doctors personalize care. They can decide how often someone should be screened or whether additional tests like colposcopy are needed. This tailored approach helps avoid unnecessary procedures for low-risk infections while focusing attention on those at higher risk. It makes prevention more efficient and less invasive. On a broader level, understanding which HPV types are common in a community guides public health efforts. Vaccination programs for both girls and boys help reduce the circulation of high-risk HPV types, lowering the overall incidence of HPV-related cancers. Education campaigns can also be tailored to inform people about the importance of vaccination and screening, empowering them to take control of their health. In summary, knowing HPV types plays a crucial role in reducing cancer risk. It helps guide vaccination strategies to protect against the most dangerous strains, informs targeted screening and early detection efforts, allows for personalized medical care, and supports public health initiatives. This comprehensive approach is essential for preventing HPV-related cancers, especially cervical cancer, which is largely preventable through vaccination and regular screening. Always remember to consult healthcare professionals for personalized advice and to stay updated with the latest guidelines from trusted health authorities.